it's that time of year to spring forward again. Sunday, March 9th at 2 a.m., it's time to set our clocks ahead by 1 hour to enter daylight savings time. According to the CDC, switching to daylight savings time can disturb sleep, cause health issues, and lead to an increase in traffic accidents and work safety events. As part of the upcoming Sleep Awareness Month in March, Garnet Health sleep medicine provider Dr. Ellen Bradley is joining us with some information on the importance of sleep, tips for healthy sleep hygiene practices, and some of the most common sleep disorders. We should note that Garnet Health is a financial supporter of Radio Catskill. Dr. Bradley, good morning.
Good morning. Thank you so much for having me.
Well, thanks for being here. And yes, it's that time of year again to spring forward. As daylight savings time is upon us, how does the time change impact sleep, and why is it particularly important to be mindful of it at this time of year?
Yes, that's a great question. So when we spring forward, we are supposed to go to sleep earlier and wake up earlier, like that, right? Just overnight. So this sudden shift in the time change doesn't equal a sudden shift in our bodies, right? That's pretty sudden for us. So we see a lot of societal implications from that sudden shift. Like you mentioned, there are more car accidents. The number of fatalities from those car accidents also increases by about 6% in the days following the time change. People have more heart attacks, more strokes. They go to the emergency room more and end up getting hospitalized more. And people just feel worse. They're tired. They're less productive at work. They may not be as sharp at work as well. And it dramatically impacts us as a society. Things we can do to try to minimize those disruptions: getting enough sleep. So trying to get at least 7 hours before and after this time change is recommended. Transitioning slowly, right? So a 60-minute change is pretty dramatic for the body. So trying to be more gentle, maybe 3 or 4 days before the time change, moving your bedtime 15 minutes earlier, your wake time 15 minutes earlier, all your daily activities, your meals, exercise if you do it, everything 15 minutes earlier. And doing it slower can be much more gentle on the body and ensures that you get enough sleep. And the other thing to use in your favor is light. So light is undervalued but can be so critical in your sleep health. So if you are able to go out early morning and just be in the sunshine, that will help dramatically, because what happens is you go outside, you're exposed to all this light, and it can't be just office light. It can't be just home light. You need sunlight. It's much, much, much more powerful. When you get that light, it signals your brain, okay, it's time to wake up. It's time to be alert. And it also signals your brain that later it will be time to be sleepy. So if you wake up your brain earlier, it will get sleepy earlier. So getting enough sleep, giving your body time to transition, and getting early morning light are 3 of the best things you can do to kind of ensure your safety and your efficiency. I hadn't
thought of it that way, by taking, it's not my favorite time of year, to be honest, and that whole hour, but like breaking up that hour into 15-minute increments and maybe, banking those a few days in advance, like even starting tomorrow, going to sleep a little earlier, that might help, right?
Yes, exactly. And it's not just your sleep times. It's not just going to sleep and waking up. It's every part of your day. It's your meals. It's your exercise if you do it. Whatever you are able to shift forward in small increments will help you.
So we mentioned also that March is Sleep Awareness Month, well-timed. Let's talk about sleep hygiene and why it's crucial for maintaining healthy sleep habits.
Absolutely. So sleep hygiene is basically sleep habits. So it can be daytime habits or nighttime habits that optimize your chance of success with sleep. So daytime habits, as we kind of alluded to, we said the sunlight thing. It also includes eating breakfast when you wake up, avoiding a heavy meal at night, because eating tells your brain, okay, it's time to wake up and function. Getting exercise at all dramatically improves your sleep quality at night. Ideally, if you can do it earlier in the day, but I would much rather you exercise before sleep than not exercise at all. But again, earlier in the day is better. avoiding alcohol and caffeine close to sleep, as those can negatively impact sleep. So those are the daytime things that you can do to optimize your sleep. And then the sleep hygiene at night. I mentioned getting 7 hours, trying to get 7 hours. Again, everybody's a little different. Some people need more. Some people are okay with a little less. Maintaining a consistent sleep schedule is really important. And something that I think is underemphasized in America is a wind down routine, because Americans are always go, go, go. They never stop. There's so much to do. You can never get it all done. And a lot of Americans expect to go from 100% and then they get in bed and they can pass out. But that's not realistic. That can't happen. Your brain doesn't just shut off like that. So having a wind down routine is crucial to transition your brain from being awake to being asleep. So that can look a little different for everybody. But avoiding screens, as hard as it is definitely recommended. If you need some stimulation, you can certainly do a podcast, or you can listen to a sleep story. It's staring at the screen that's the issue. If you could do puzzles, relaxation activities, whatever you need to do to relax and unwind, you should do it, because it is so hard to go from 100 to 0. And you don't want to be laying in bed tortured, tossing and turning. So implementing that wind down routine is crucial for your sleep. And then along those lines, bed equals sleep. Bed doesn't equal reading an exciting book or watching TV or all these wakeful activities. Your brain should associate should associate your bed with sleep only. So you should only be sleeping in bed and intimacy. That's it. And then keeping your bedroom dark, quiet, and cool. So those are some of the sleep habits or sleep hygiene that you can implement during the day and getting closer to the evening to help transition to sleep and optimize your sleep.
And maybe no bread in bed, too. You're a sleep medicine provider. You specialize in this. You're a sleep medicine provider. So what are some of the most common sleep disorders you treat? And how do they impact overall health?
Yes, great question. So the most common sleep disorder that I treat is sleep apnea, which at this point most people have heard of. Also, people who don't get enough sleep, like people with insomnia and probably restless leg syndrome. Those are the most common things that I treat. But I do treat other less common disorders like narcolepsy. Some of our early birds or our night owls have trouble sleeping, sleepwalking, things like that. And how do they impact our health? So all of these things are issues with your sleep, right? You're not sleeping properly, whether it's too much, too little, you're not breathing right, your brain isn't fully asleep. All of these are issues with our sleep, and we need sleep to function during the day. It impacts our mood. It impacts our physical health, our financial health, our relationships. It impacts literally everything about your waking life. So whatever sleep disorder you have, it can profoundly impact your life. And that's why I'm so passionate about it, and I love sleep medicine, because all of these things we can evaluate and we can treat.
How does insomnia differ from other sleep disorders, and what are treatment options that are available for insomnia, which I think is something maybe is a default for some people who think they can't sleep, like, oh, I have insomnia.
So I would recommend seeing a sleep provider or at least your primary care provider to discuss this, because insomnia can often be other medical problems, or that you're a night owl and you're trying to be an early bird, things like that. So there are other factors at play that could contribute to insomnia. But insomnia is tricky because it's when you want to sleep, you can't sleep, whether it's when you go to sleep at night or you're waking up in the middle of the night. And we've done a lot of studies on insomnia and how to treat it. And basically, there's two schools of treatment. One is called cognitive behavioral therapy for insomnia, or CBTI, and the other one is medicine, right? So cognitive behavioral therapy for insomnia, if you've heard of that before, it's totally different from CBT in psychiatry or in anything else. It's cognitive behavioral therapy. So we change the way you think about sleep to impact your behaviors to make a change and make you sleep better. So our studies show that basically changing the way you think about sleep and changing your sleep habits has a much better and long-lasting impact on treating your insomnia than pills do. Because a pill is a Band-Aid. It helps you tonight, but it doesn't help you tomorrow unless you take the pill. So it's kind of, people with insomnia have tried everything they can to improve their sleep. They've tried everything that makes sense. So then you go to a professional and you get this treatment, and they teach you proven skills and techniques to implement to improve your sleep. It's kind of the things that don't make sense because you've tried everything in your wheelhouse to help you, and now you need a little extra help.
In preparing for this interview with you, I was struck by this statistic in the blog at Garnet Health about sleep issues that the American Academy of Sleep Medicine survey shows that over half of Americans have never discussed sleep issues with their doctor. Why do you think that is? And what should be the first step for those struggling with sleep?
Yeah, so sleep medicine didn't even really exist until the 70s and 80s when the first sleep study was done. I remember growing up, my dad snored so loud, and nobody knew about sleep apnea. We just all lived through it and were woken up all night every time on vacation. But I think over the past few years, we've learned so much more about sleep. We have so many more providers being trained in sleep, and we, as a country, we're focusing more on prevention now, right? We don't want to just treat the heart attack when someone comes into the hospital. We want to prevent it. So getting good sleep is now fitting into that. Physicians talk about a healthy diet and getting exercise, and the third component of that is sleep. So I think a lot of busy Americans think they can get by without sleep. But sleep impacts everything: your mood, your physical health, your emotional health, your financial health, your relationships, everything. And I think it's becoming more important, and I think doctors are starting to talk about it more. But I also think patients and people are asking more questions. So I would encourage you, if you think you have any issues with your sleep, to go see your primary care provider, or you can come see us at the sleep center at Garnet Health.
Yeah, it sounds like we had the same dad growing up.
Yeah, I think a lot of us have that same dad.
Yeah, lived through it. Oh, you're right. Now you mentioned the sleep medicine at Garnet. You have those sleep studies, both at the in-center and at home as well, which is interesting. How did those work, and how can people get more information?
Absolutely. So you can go to your primary care provider, or you can contact us. You can go to garnethealth.org/sleep center, or you can reach out to us at 845-333-7575 to set up an appointment with myself or another sleep physician. So that's the really nice thing about sleep medicine. Over the past few years, we have created home sleep studies. So you can do a sleep study to be evaluated for sleep apnea, for your snoring, in the comfort of your own home. How that works is our sleep center will have you come in and teach you how to put it on, but it's basically 2 belts, one on your belly, one on your chest, a little sensor on your finger, and then a little sensor on your nose and mouth to look for snoring and breathing. And you just wear it for one night, and that's the whole test. And then you come back in and talk to me, and we discuss the results and the next steps based on what we found.
That's Dr. Ellen Bradley, Garnet Health sleep medicine provider, talking to us about daylight savings time and how to prepare for that, and also sleep hygiene. More information at garnethealth.org. Dr. Bradley, thank you so much.
Yeah, thank you so much.
And don't forget to spring forward this Sunday. Set your clocks ahead by 1 hour to enter daylight savings time.